Dr. V. Mohanan Nair, sir, Professor of GIPH, and Dr. Altaf Ali, Professor of Community Medicine, Medical College, Manjeri. Dr. Shafi will be talking on mistakes and lessons from the Western world, how to screen interstate and international visitors post-lockdown. Most of you are familiar with Shafi. Shafi is currently in Boston, in US, and US is probably dealing with the worst impact of the epidemic at this point, with the most number of cases and deaths which are in the process of overtaking Italy at this point. Shafi.
Okay, thank you, Anand. Good evening. Can you see my slides?
Your slides are visible.
Okay. So basically, just a quick note that I mean, we had a lot of lessons from the West, maybe in terms of like how badly the West had handled the current epidemic. I'm just to quote a French president, who said on March 10th that Austria made a bad decision by restricting travel from neighboring Italy. And if you can just see how the cases have, come across in both the countries as the days passed, it was like, Austria could control it, even though they had similar population density, but the number of cases and the number of deaths in France was far, far higher than what would have been otherwise if they had gone for a restriction in travel. So it makes sense that India went for lockdown in the initial phase. And just I am reading the news that probably we are going for another 2 weeks of lockdown from the meeting of Prime Minister with the chief ministers. So I think this has to be weighted against the benefits and the risk. So what can we do in the Kerala context? I would say that we should be very proud of our existing surveillance system, the grassroots healthcare workers. We should continue that vigil. But at the same time, as news, today morning I heard that the UAE ambassador has mentioned that they are willing to shift our expatriates working in UAE, which is around 2 million people, back to our home state if we are willing, especially the people who are not ill. So we should expect that we will have a lot of international travelers back to our state in the next few weeks if these things are going to work out, which means we have to be extra careful in preparing our immigration clearance, speeding up immigration clearance. Even we can have there are possibilities to have immigration clearance right at the port of departure, which for example US does that in many of the Gulf countries. And we have to have makeshift arrival facilities with cross ventilations and ease out the customs clearance and all those things, because this is very essential so that we don't delay the quarantine. And I am of the view that the quarantine should not be at the home. And as I think Dr. Jayakrishnan mentioned, home quarantine has its own difficulties, and especially if we are going to have a large influx of people. I would suggest that we should go with the Trivandrum model, which Anu had initiated initially. You prepare facilities within the airport city itself to accommodate them from 14 days, a maximum period, and then you shift them back to their homes, which I think we should be able to do that given our scenario. And also, even though we may have our own surveillance system in our airports, people will come to a different state and then come to our state. So we should have something in our village level with the revenue department monitoring these things, and so that we don't miss any passengers landing in any airports in other states. Of course, regarding the lockdown, I would say we should have a soft lockdown and with an improved surveillance. We have to relax travel restrictions, except in pockets with ongoing active cases. And we have to develop some norms for specific sectors. How do we manage agricultural sector? How do we manage small businesses? How do we manage big industries? Because this is not going to end at least in a few weeks. So we have to anticipate something which is like a longer duration of time. We should promote social distancing and hand hygiene as we are doing it. We should plan now itself to move to online classes for schools and colleges in coming academic year. And another important point, as Anu rightly mentioned, we are very much dependent on other states for many of our day-to-day living. So we have to have a close, improved surveillance in interstate checkpoints. The state, we cannot prevent them from driving in, and also we have to arrange facilities for the other state drivers to, when our people are unloading the lots, and they should be trained as well. And I believe that agricultural or animal husbandry department should coordinate the market operation, which is now like a private operation, So we should actually try to coordinate the operations with inputs from health department, as long as we are away from this outbreak. Another important thing that I would like to mention is that we are collecting excellent data from the field. Our JPHs and JHIs are collecting that, but I feel that we should have it as a centralized system so that we can use the data for better planning and resource allocation rather than keeping it at the lower level. As I would say from experiences, for example, here, we are actually involving teachers and college students as volunteers with an online training for technical and ethical issues on data handling. We can use them for primary and secondary contacts, because we need our health workers to be spared to do more important thing in coming days. This is my personal opinion. So we need to have volunteers trained to handle those things, calling up and following up with primary and secondary contacts in home quarantine. And we should have a secure system with the data hosted at the local server. So that's important again, because it has a lot of personal information. Then we should use this data for better informed decision making. And this is the most important slide that I want the attention of everyone. We have to immediately start prioritizing a testing strategy, because we are still testing only the contacts or essentially the cases. So we need to have a more broader understanding of the epidemic, which is non-existing now, I would say, in any country, but Kerala can do that. We should have a priority list of people whom we should test. We should be essentially, informing our decision on how we should go forward. And this should also go into a model where we can assess the cost effectiveness of different levels of social distancing and different levels of lockdown, because we cannot continue a lockdown indefinitely. So we need to have an assessment of what should be an appropriate level of lockdown going forward. So this is from my end. Maybe we can discuss now or at the end.
Thank you, Shafi, for that excellent wrap up of the topics. I would like to invite Mohan Nair sir and Altaf to join the discussion. Mohan Nair sir, you have to unmute your mic. Mohan Nair sir, you have to unmute your mic.
Am I audible now?
Yeah. Yes.
Yes. Thank you, Shafi, for the excellent presentation. You have touched upon almost every point. But at this point in time, I would like to add that, we don't have any lessons or mistakes, because we are dealing with something new. So every country or every person who is coming out with suggestions or propositions, they think that whatever they are doing is correct. But from a scientific point of view, or from a public health point of view, as we often tell, is pre-warned is pre-armed. We were never warned, so we were never armed. But at this stage, of course, we are armed with something. We have some data, we have some information. And confining myself to the point that we are discussing, of course, we are going to have a large influx of people, both from outside and from inside the country to our state. So how are we going to handle them? And of course, Dr. Lal spoke about public-private partnership in terms of dealing with patients. Once again, JK also touched upon that point. But I think one more important or pertinent point along those lines is having more of public facilities, as Dr. Shafi mentioned, to have these people quarantined. Like having more of, say, private beds to have or private ICUs to treat the patients. We should have more of public facilities to quarantine these people who are coming from outside, rather than, as Shafi rightly told, sending them to their own homes or quarantine. That's the most important point. And second point, of course, is about people who are coming from other states to our state. On which we don't have much of a control, especially the political administration in Kerala is also welcoming such influx, because we can't keep those people away from coming to our state, because they are coming either for work or for treatment, which cannot be denied. But how to deal with those people? We have to have a very robust way of getting information from those people. And another thing is, now that since that we are going to have a large influx of people, among whom there could be people who are having asymptomatic disease, the screening in terms of testing needs to be made widespread. So this is the time when we should be going on for widespread testing, probably or preferably with rapid testing. So rapid testing on the people who are coming in, facilities to have them quarantined, preferably in a public quarantine place rather than sending them to their homes, and having robust data on people who are going to come to our state from the other states in India for various reasons, and widespread testing to pick up the, say, or to pick out the all the asymptomatic people who can spread the disease in the community. And of course, as my partner Dr. Altaf usually tells about everyone, if you look at the channel discussions and all, everyone is speaking about that medical model of health. Of course, we are dealing with something entirely different. We have to look at the social milieu in which we are living, and social distancing in different categories of people, how they are to practice that. So the most important part is equipping them to go back to their normal life while keeping all the principles of social distancing alive, and also doing all the things that I have mentioned. Now over to Dr. Altaf.
Thank you, sir. In fact, almost all points covered by Shafi and Mohaner sir. It was a very excellent presentation within that particular limited time. Anyway, regarding the lessons, as Mohaner sir pointed out, since it's a new virus and very actually only just hardly 3 or 4 months only we have got exposure. And one thing I have to mention here is when the first outbreak, the first cases reported in Europe as well as in US at the same time, in the same week, the first case reported in Kerala itself. That is the scenario, January last week. And whatever lessons the West had, and almost we are also having the similar kind of lessons. And at the same time, we were also watching rest of the world, across the world, all of their experiences, and we are trying to learn the right things and wrong things. Especially one example, right now, Shafi pointed about the coming back of expats from the Gulf. It may be around, I think, something around 1 or 2 millions will be there if we are going to receive them, and it's quite impossible to accommodate all of them in quarantine home like that. So one bad lesson we have is it is some kind of that thing happened in UK. Actually, they opened the borders after the heavy surge of upsurge of cases in Italy. The UK opened their borders and received all their even after that they received the cases, and that was the main reason for this the surge of cases in UK and in France also. So there are a lot regarding the US was actually they were considering it as a minor issue, just like a similar routine flu kind things. Even at the 3rd week of January, at the same time, Kerala opened a control room. Kerala instructed strict screening and quarantine all its port of entries, and that was we were doing for the last 3 or 4 months. And since that, after that first 3 cases, we got the 4th case only after 1 month. And after the lockdown also, we postponed that spike for another 1 month or 1.5 months. We are postponing this. Anyway, we are anticipating a heavy surge within a couple of weeks or months. But we are trying to push that thing. We are trying exploring all possibilities. And we are, of course, we are interested. We are inviting. We are taking lessons from other countries. And one more thing I have to add is while diluting or easing the restrictions after the lockdown, one important point is Kerala. Right now, Kerala's position is almost 8th or 9th position among the other states. It was first, actually, it was holding the first position in January, but right now it is on 8th or 9th position. And within a few days, it will go down to 12th or 13th position, because all other states, there are a lot of cases reporting from all the neighboring states. And one important threat for us is many number of cases will come from other states, neighboring states, and we have to make a plan for strict screening all our interstate borders, apart from the international borders. So these kind of things we have to add along with the suggestions of Shafi and Monica. And
Thank you.